We are going live in YouTube now. I think all the participants of Research Alchemist group can log in through that now. We'll be starting the presentation in 2 minutes. All right, we are good to start now. Hi, hello, and very good evening. So it's 8 o'clock now. Now, this week we are going to have, as a continuation of our journal club presentation and research dissemination, today we are going to have like two beautiful presenters. One is Dr. Nanjesh Gowda, who's MD scholar from the prestigious SDM College, Ujjire. And so, I know Dr. Nanjesh like for the past few months, ever since he has he has been into this decoding diabetes and diabetes reversal program. So I know him for his commitment right from day one. So he's going to be the first presenter, and the topic I was really impressed with the topic when he just wanted to present it. It is about the ice massage what we generally give for neck and for spine. If you want to reduce the blood pressure immediately, that's one of the emergency treatments what we give in naturopathy. And today Dr. Nanjesh is going to share with us on how it's going to work and whether it is effective or not, and if effective, how it is. So that would be the first presentation, and the second speaker for the day, it's going to be Dr. Naveen. Dr. Naveen from Sona Yoga Naturopathy Medical College, and he again is a very good orator. We met him in Pondicherry conference. In one of the conferences, the way he had presented in a simple and straightforward way, every single person who were listening to the talk were really impressed. It was really amazing, and it is really wonderful to have both the speakers for today's presentation. And yeah, I think we can start with Dr. Nanjesh Gowda's presentation. Yes, Dr. Nanjesh, over to you.
Thank you, sir. Can you start, sir?
Yes, please, you can start.
Good evening, everyone. So I welcome everyone to today's journal club. So in today's journal club, I am presenting a paper. The title "Effect of Ice Massage to Identify on Blood Pressure and Heart Rate Variability in Patients with Hypertension," a pilot study, which was done by Dr. Mohan et al. On September 2021 by Multimate Publisher in International Journal of Therapeutic Massage and Bodywork, which is an impact factor of 0.53, which was indexed in PubMed. Before going in depth into the paper, so first we will have a overview about autonomic function. What is autonomic function? Autonomic function is responsible for regulating involuntary body functions using autonomic nervous system. What are those autonomic nervous systems? There are two. One is sympathetic and parasympathetic. What is the importance of those sympathetic and parasympathetic in our daily physiological activity? Sympathetic activity will increase For example, when you saw any snake or when you saw any dog like that, so during that time our sympathetic activity will increase. That the intention of to increase sympathetic activities protect us from the snake or anything. So during that time our heart has to pump more blood to protect ourselves from the snake. Means our heart tries to push or pump more blood towards the periphery. That is one thing. And other than that incident, in normal physiologically our heart needs some sympathetic stimulus for contraction. So that is regarding sympathetic. So when it comes to parasympathetic activity, the parasympathetic has function to balance sympathetic tone, as well as during other than the balancing of sympathetic tone, it has its own function like from lacrimation, salivation, peristaltic movement and defecation. So these are the parasympathetic activity will control these many functions. So next we move on to the heart. What is heart? Heart is, in a general term, heart is a functional unit of body which pumps blood to all over the body to fulfill the needs of all the physiological activities. So how we will quantify the function of the heart? Just by using ECG. What is ECG? We are quantifying the function of the heart through the surface electrical activity by representing in terms of PQRS, which this PQRS represents cardiac cycle. What is cardiac cycle? Which means a sequence of events that occurs during a single beat. Means in a single beat there will be sequence of events will be happening. Those may be either contraction and relaxation of atrium and ventricular. These will form one cardiac cycle. Means one cardiac cycle in the sense one beat that will covers under PQRS. Means the duration for complete one cardiac cycle is 0.8 seconds. Then do you think that this 0.8 second will be same to all the successive beats? The answer is no. Why? The reason is in your body there are so many physiological activities will be going on. Some are sympathetic, as I told, for heart contraction you need sympathetic activity, whereas some are parasympathetic, as I told about lacrimation, salivation. Your heart has to respond for each and every physiological activity, either maybe sympathetic or parasympathetic. So to give a proper response, your heart try to compensate for all the physiological activities. That's why the duration of one cardiac cycle will be vary from one beat to another beat. As I displayed a figure, in the first beat the duration will be 0.859 milliseconds, and second will be 0.793 seconds. So means you can able to see the difference between the duration from one beat to another. Means your heart is reacting in a different way for your different physiological activities. So now you can these variability is called as heart rate variability. Are you clear in the heart rate variability? Now can we or can we use this heart rate variability as a tool to assess the balance between sympathetic and parasympathetic activity? And the answer is yes, because as I told that in our body both sympathetic and parasympathetic activity will be happening. So give a proper response, the main the main response will be coming from heart. So by if we quantifying the variability of our heart, we can easily quantifying the autonomic balance in a person. So this is regarding heart rate variability. I think everyone is clear with what is heart rate variability. So to quantify heart rate variability, there are three ways. One is long term, means we will be quantifying the heart rate variability over a period of 24 hours. And second thing is short term, means just for 5 minutes. And ultra short is less than 5 minutes. Whereas long term is a gold standard one, but it is practically difficult to record 24
Dr.
hours.
Manjesh, sorry to interrupt. Your voice is not clear, it seems. Can you be a bit more louder, or is possible in a better place where you can get network? Because people from YouTube stream, they are saying voice is not clear. Yeah, I mean, it's slightly breaking. It's not like completely gone or anything of that sort, but it is slightly breaking. Okay, just wanted to let you know. Yeah.
Can you hear me, sir?
No, it's breaking now.
Whether it's clear, sir, now?
Yes, it's clear now. Okay, just wanted to let you know. Just
Okay.
take it
So
in a
after this,
and one sec. A general instruction to all, as we have like many students, like over 250 plus students, especially are interested in this like research dissemination. Dr. Nanjish Gowda is covering the basics of HRV and the autonomic nervous system and other things, so that we would be able to understand things right from the basics. Don't think like it's all very basics. I know like most of us are known and many of us don't know. So please do what I say, cope up with the speed as such. Is beautifully explaining right from the basics before going into the actual topic. Yes, Dr. Nish, please continue.
hello sir.
Yes, Nish, continue.
Shall I continue, sir?
Yes, please, yeah.
The next thing is we should be more familiar with baroreceptors. What are these baroreceptors? Because baroreceptors nothing but a stretch receptor which were present in our carotid sinus. For example, if we got any fear, due to that fear we suddenly get gas. So during that time there will the pressure will build up in your carotid sinus. If the pressure was built up in our carotid sinus, our carotid vessel will get stretched. Due to that pressure stretch, our baroreceptors will also get stretched. So due to this baroreceptor stretch, there will be efferent impulse will be transferred through the glossopharyngeal nerve, to medulla oblongata. So in medulla oblongata, that will generate a that will transmit a inhibitory signals to the cardiac pacemaker through the vagus nerve. Means the vagus nerve got activated from the medulla oblongata, that will act as inhibitory signals to the cardiac pacemaker. Obviously the heart rate will reduce. So everyone should be familiar with this mechanism. Means uh, because this baroreceptor sensitivity will be most important for maintaining the blood pressure. The next thing is how we are to quantifying the heart rate variability. We are quantifying this heart rate variability in terms of two domains. One is time domain and another one is frequency domain. What are these time domain and frequency domain? Means we are quantifying the heart rate variability in terms of change in time. As initially I told that variability is nothing but the change with respect to successive beats. So here time domain means we are quantifying that change in terms of time, and frequency domain is nothing but we are quantifying those change in terms of oscillation. That is nothing but frequency domain. So in that time domain we will be having series of variables with respect to time domain and frequent domain. So I will not go in detail about time domain. I will be mentioning of the major important points which we should be concentrate more in time domain. The first and foremost thing is average RR. What is this average RR? RR means the average RR means the interval, the time interval between two RR intervals is nothing but average. If we take the average time interval of RR interval is nothing but average error. Now you can tell me if we have more average RR, or if we have more RR intervals, what we can tell is that is because of sympathetic withdrawal. So make sure that if we have more average RR, that is because of sympathetic withdrawal. Means you have more variability. And second thing is SDNN. In some of the papers you may see SDNN, and so in some of papers you can see SDRR. What are these SDNN and RR? N is nothing but normal to normal. As we everyone know that our pacemaker is from SA node. The NN means the variability software will detect the someone is correctly it's okay. So we will be quantifying the we will taking the data which were generated from the SA node, that is normal to normal. SDRR means we are quantifying or we are including those beats which were generated out of the SA node, that we call it as ectopic beats. So standardly we will take SDNN because we are quantifying only normal beats which were initiated at SA node, that is SDNN. Next we will come to NN50. What is this NN50? As in the first initially I have told that in a figure there is a time interval, the difference between from one beat to another beat means, for example, at first beat I have 850 milliseconds. At second beat I will be having 950 milliseconds. Okay, means we have seen some 80 milliseconds of change from one beat to another beat. Means in these NN50 it will quantify the number of intervals which were differs more than 50 milliseconds from previous beat, that is NN50. PNN50 is nothing but the proportion of those NN50 bits, that is PNN50. So next we'll come to the major and most important the variable in time interval is RMS60. What is this RMS60? Root mean square. Initially I have told that SDN is standard deviation. Here we are mean, first we'll take mean and squaring and rooting those of the standard deviation of successive difference. Means if we have more successive difference, we can tell that that is due to parasympathetic nervous activity. And we'll come to frequency domain. We'll be having three majorly: LF, HF, and LF HF ratio, where LF will be defined on both by sympathetic and parasympathetic. HF will be purely depend on parasympathetic. So as we know that due to increased sympathetic activity, that will lead to vasoconstriction, that will lead to hypertension. Due to increased cardiac output, lead to hypertension, and due to increased sympathetic activity, that will increase reabsorption species and increase renal reabsorption. So when it comes to the abstract part, here they use ice massage. I said is one of the hydrotherapeutic procedures they have used here, and they have taken 15 hypertensive subjects. They have given 20 minutes of ice massage of only one session, and what they measured was blood pressure, majorly SBP, DBP, and heart rate variability. What result they got was they got significant change only in SBP, DBP, average RR, or RR interval, R, and heart rate. And conclusion, what they concluded was results suggested that 20 minutes of ice massage to head and spine may reduce blood pressure and heart rate in patients with hypertension. However, there is no evidence that this provides any significant clinical impact for the patient, because this is an immediate effect study, because they didn't study any prolonged effect or long-term study. So I don't want to go in depth about hypertension and all introduction, but main what we have to observe in any paper in the introduction part is what is the intention of doing this research by a researcher. That is because initially the same author, Dr. Mohankan sir, did a same ice massage head and spine on healthy individuals. They got a significant difference in both blood pressure and in all the domain, significant change in all the domains of heart rate variability. So based on this evidence, they applied ice massage head and spine on hypertensive individuals. So when it comes to methods, that here they have used studied in a single group, pre-test and post-test study. Means there is only one group, and they have given them, they have taken data at baseline, and they have given intervention for 20 minutes, and they have taken post data. And the participants were all hypertensive individuals. Out of 15 hypertensive individuals, 6 were males, 9 were females. Those who are on antihypertensive medication. The mean age group was 48.87, with standard deviation of 11.17. Study setting was holistic health center in South India, and the inclusion criteria is like they have taken both male and female from the age group of 30 to 70, because they have taken 30 to 70 because the prevalence of hypertension will be present morely in this range, and history of primary hypertension either or not on the regular medication, and those who are willing to participate. And they exclude, the exclusion criteria was like history of secondary hypertension, hypertensive complication like CAD and all, and those who have had participated in ice massage in previous week. Why they excluded them? Because we don't know for how many days our ice massage effect will prolong. That's why they excluded those patients who had taken ice massage in a previous week. When it comes to procedure, the subject will be lying down in a prone position. They have used ice cubes of 1 degree to 2 degrees Celsius, and they will apply over from crown, back of head, and right and left sides of the head, and followed by to the cervical, thoracic, and lumbar and sacral region. And they will keeping that ice cube for 3 to 5 seconds, and they keep on displacing from one place to another place for the duration of 20 minutes. And the assessment they have used was blood pressure, and they have checked the sitting position, that is SBP, DBP, and they have checked heart rate variability. They have used lead to configuration, and they use AGCL electrodes, because those silver chloride electrodes would be good receive the electrical activity of the heart. And for the, when it comes to data analysis, they have used first, if you got any data, first we have to see whether the data is normally distributed or not. So they have used Shapiro-Wilk test because the sample size is very less. So based on that normality, they have done paired sample t-test for those data which were normally distributed, and for those data which are not normally distributed, they have done Wilcoxon sign rank test. So when it comes to the result part, I will conclude in a simple way that in these studies they have got result significant change only in SBP, DBP, RR interval, R nothing but average RR, and heart rate. Only they have significant in these four variables. And when it comes to discussion, but what we have to explain is why they got significant only on those variables. But in a previous study, the same study was done by Dr. Mohinter sir on healthy individuals. They got a significant result in both time domain, frequency domain, and blood pressure. But here they got only limited. Why? Because what change they got here was first and foremost thing is they got increased RR interval. Means initially I have told that if we have increased RR interval, this shows that due to sympathetic withdrawal. Due to sympathetic with increased RR interval, obviously our heart rate gone down. So if due to decreased heart rate or blood pressure got down. So other than this, how we can conclude this discussion apart, why it got so much result in healthy individuals, but they didn't get in hypertensives, maybe because here we got only sympathetic withdrawal. Why we didn't get parasympathetic activation means initially I would mention about baroreceptor activity. There are so n number of evidence telling that those who are hypertensive, their baroreceptor sensitivity will be very less. So that's why due to this study's limitation of only immediate effect, so they didn't get the parasympathetic activation, they got only sympathetic withdrawal. So when it comes to limitation of the study, they didn't check how long the effect was sustained, because this is due to less sample size and due to less sample size, and they maybe they if they for future studies, if they check peripheral artery resistance, continuous BP monitoring, as I mentioned about baroreceptor sensitivity matters more. So when it comes to strength of the study, because this is the first ever study to be done on hypertensive individual by ice massage to I would like to thank Mohintan sir for giving these two wonderful papers. And at conclusion, what they got was results suggest that 20 minutes of ice massage to head and spine may reduce blood pressure and heart rate in patients with hypertension. However, there is no evidence that this provides any significant clinical impact for the patient, because they can't conclude by just by giving immediate effect results. So at least they need prolonged effect or long-term effect. That's why they mentioned that these provides no evidence that these provide any significant clinical impact for the patient. So this is regarding paper. What are the other mechanisms we can correlate with these ice massage work? There was a study done by Jain Raj et al. On immediate effect of cool spinal bath on blood pressure in healthy individual. What they mentioned was, and I have added modified few things, means whenever we apply cold on any surface area, that acts on superficial reflex areas, means that will induce sympathetic arousal. We can consider that as action phase, and due to that sympathetic arousal, that pressure was increased on carotid body, that due to sudden gas, that is reaction phase. As I initially I have told that due to this sudden gas, the pressure built up in the carotid body, that will elicit efferent impulse to the nucleus of solitary tract through the glossopharyngeal nerve. As I told, glossopharynx is efferent nerve. So that it acts on postganglion dorsal motor nucleus, which is present in medulla oblongata, which has parasympathetic fibers. Which is that parasympathetic fiber? That is nothing but vagus nerve. Due to that vagus nerve activation, the blood pressure got decreased. So and this is the probable mechanism which I got. So before knowing this mechanism, we just have to know about two things. Only the basic physiology. Because whenever if you are giving any cold application to any patient for decreasing blood pressure, means we are not giving direct cold application to any of the nerve. That was induced because of the catecholamines release. What are those catecholamines? There are three major catecholamines. One is dopamine, norepinephrine, and epinephrine. These catecholamines will be playing a major role in maintaining on receptors. So these are catecholamines. Other than this, we have to know about adrenergic receptor. There are two types of adrenergic receptor, alpha and beta. In alpha, there are alpha 1 and alpha 2, because These adrenergic receptor will be mostly present in vessels. Keep in mind, alpha 1 and alpha 2 will be commonly present in vessels, because this is very much important. And beta 1 adrenergic receptors were present in heart. Make a note. Beta 1 will present in heart, and beta 2 will be present in lungs. Okay, so I think these things are clear. So when it comes to when we apply cold application, we will get a local effect. For example, when you apply cold application, our vessels will get contact. Why? That is because when we apply cold application, that will induce norepinephrine. The norepinephrine will activate alpha 2 adrenergic receptors. I initially have told that alpha 2 adrenergic receptor will be present in vessels. So that will, if alpha 2 adrenergic receptor was activated, that will lead to vasoconstriction. This is one part, local effect. When it comes to our study like ice massage, if there the heart has two controls. Initially I told sympathetic control and parasympathetic control. Sympathetic control of the heart will be taken place by the spinal nerves. Note down, spinal nerves which were originated from T1 to T5 vertebra. Okay, so these spinal nerves will control the sympathetic activity of the heart, and parasympathetic activity of the heart will be controlled by vagus nerve. Okay, so when we apply cold application, that will release catecholamines. As I told, if catecholamines is nothing but norepinephrine. If norepinephrine was increased, that will activate alpha 2 adrenergic receptor. If alpha 2 adrenergic receptors activated, that will decrease the sympathetic firing. Obviously, if that sympathetic firing of spinal nerves originated from T1 T5 vertebrae decrease, obviously the heart rate will be decreased. And the last mechanism was, everyone we know that if we have a sympathetic activity, we have again the norepinephrine will release. Don't get confused that the norepinephrine will has to release only at cold application. It will be released during sympathetic activity also. And initially I have told that norepinephrine has also have an affinity towards binding to beta 1 adrenergic receptor. Where the beta 1 adrenergic receptor will be present in the heart. So when the norepinephrine will binds to beta 1 adrenergic receptor, that will increase the calcium ion in heart cells. That is nothing but positive ionotropic effect, and that will induce smooth muscle contraction. If smooth muscle contraction was induced, that will help to increase heart rate. That is positive chronotropic effect. So this is one part. So when if we have a result telling that there is a increased HF and RMSST, concluding that due to parasympathetic activation, we can correlate by, due to increased vagus nerve activation, that will release acetylcholine. These acetylcholines will bind to M2 postganglionic muscarinic receptors. When the acetylcholine binds to this M2 receptor, that will decrease norepinephrine. Don't get confused that in the previous slide I have shown that the norepinephrine will activate alpha 2 adrenergic receptor. Okay, here is a dual effect. So due to decreased release of norepinephrine, that will decrease the influx of calcium ions. And if calcium ion is decreased, means that is negative ionotropic effect. So due to decreased calcium ions, that will decrease smooth muscle contraction, and that will lead to decreased heart rate. This is the negative ionotropic effect. And the last slide was like, there is a paper telling that in this paper they have used ice cubes. In this paper they have tried compare between tubed ice, crushed ice and wetted ice. But finally what result they got was, wetted ice as a wetted ice produce a lower given greater result by decreasing the surface temperature. Means if we use wetted ice in place of ice, we can expect more result by, it will reduce the surface temperature very rapidly than compared to ice cubes. So these are the research which we can correlate. Like in this study we don't have long term effect, and we didn't compare to anything. And second point is, why we can try in place of ice with wetted ice. That is one point. And third thing is duration required for the activation of alpha 2 adrenergic receptor. Because initially at last slide I have told out the dual effect of alpha 2 adrenergic receptor. We don't know if we do an ice massage to spine, how much duration it requires to activate alpha 2 adrenergic. That's a question mark. And second thing is, I mentioned about central and peripheral adrenergic receptor. Initially I have told that if the alpha adrenergic receptor, alpha 2 adrenergic receptor has to get activated, means our norepinephrine level has to increase. But in future studies we have to quantify how much level of norepinephrine got increased to induce or activate photoelectric receptor. And last point is whether if we just apply cold over the T1 to T5 vertebrae, it's enough to control our heart rate. And these are the research questions. Thank you. Sorry if I was very fast.
You are way too fast. Way too fast. Anyway, I mean, you just wanted to share a lot of information that's really, really good, and it spoke about the mechanisms as well. Your presentation, which is really good, and we will be talking in depth about the physiology on HRV and other things in the near future as well. We can bring in the experts in that. And there's one question which was asked by Dr. Rekha. What is wetted ice? What do you mean wetted ice?
But in ice cubes, here they what they here is like they will just put ice cube on an ice bag and they will apply. Wetted ice means they will fill half of the bag with water and they will fill ice cubes mixed with water is called as wetted ice.
Ice cube mixed with water.
That is called as wetted ice.
Okay, so they use with the same ice bag. It's not, they're not going to wrap it around with wet cloth or anything.
No sir, the same. They have given procedure in this
Paper. Alright.
They have mentioned procedure.
So how to apply?
Same as ice bag. We have to take an ice bag, we have to fill half of the bag with water and we have to fill that water with ice cubes. That's it.
Okay, fine. Right, perfect. So doubt is clear.
Instead of only ice cubes, we are adding water. That's
water.
It. They are telling.
Yeah, continue. Dr. Anjish, are you there? Yes, you can continue. We are explaining something.
So it should be on the whole spine from crown to sacral, right? Hello?
Dr. Nanjish, are you there?
Nanjesh?
Sir, I guess he's having some network issues.
Yeah, I think it's offline.
Hello sir. Hello sir, can you hear me sir?
Yes, Nanjish. So we have a couple of questions. So should the ice bag be kept from the crown of head all the way down the spine? Or is it only T1 to T5 you're talking about?
Hello sir.
Yeah.
So gradually we have to start from the crown to sacrum. So how
Yes.
should we go down? Like we have to keep for some time or just to swipe from
No. So from crown to the sacrum, we have to place the ice cube for at least 3 to 5 seconds. For example, first we keep our ice bag to crown for 3 to 5 seconds, and then later we'll keep on the back of the head for 3 to 5 seconds, then right side 3 to 5 seconds, left side 3 to 5 seconds, and in the cervical area for 3 to 5 seconds. And after 5 seconds, we have to displace for not rubbing. We are just place for 3 to 5 seconds, and then we have to displace for next area.
Okay, so turn by turn vertebra or just particular places we have to keep in some distance?
No, by vertebra, that doesn't matter. The area which we can cover at a previous one, below that you have to.
Okay, we have to go next.
Yes.
Should we cover the whole spinal column till the sacrum? She's
And
asking.
how many times we can repeat that thing?
Here in this paper they mentioned they repeated till up to 20 minutes. Up to 20 minutes, how much ever times we can repeat it? Because in this paper they mentioned for 20 minutes.
Okay, but you have to use the plastic bag or then only you can put that water and ice both together.
Yes, that is the future research question.
Thank you, sir.
Okay, thank you. And why is the long-term effect not known? Because I think it's not done. That's why we don't know.
That is also of the
Yeah, it's a research gap, and the good thing about the presentation is it mentions about the research gap as well. Now, again, once again, we think like few of the studies, there are so many studies on how this ice massage to neck is reducing blood pressure. It has been done previously, this, that. We have only a handful of studies on whether the ice application to the neck and the spine is having any effect on blood pressure. If your institution is having an HRV equipment or anything of similar kind, you can do the study as well. If not an HRV, even if you can just measure the blood pressure immediately before and after and document it with proper scientific publication, that is going to be very helpful and useful. Okay, this is a very simple one, but still we do not have enough research papers on it. The moment a research gap has been mentioned, it is for us, it is for our college or institutions or wherever we are studying, it becomes our responsibility to take it up forward and do such research in our institution. Thank you so much, Dr. Nanjesh Gowda, for the elaborate discussion about the paper and possible mechanisms behind it. Thank you so much.
Thank you for giving this opportunity.
Thank you, Dr. Naveen. Dr. Naveen from
I'm ready,
Sona.
sir.
Yeah, you ready? Yeah, you can start sharing the screen. So, Dr. Naveen has got a very interesting topic, you can say, Chromo auriculotherapy. So last week we were discussing about the chromotherapy and possible mechanisms involved in that. Now he's having a paper on the psychological abnormalities that can be managed through chromo auriculotherapy or auricular chromotherapy. Yes, Dr. Naveen, over to you. That's okay. If you want me to share your PPT, I can share your PPT.
Sir, please help me, sir.
Yeah. Right. Okay, I'm sharing screen now. Okay.
Sir, it is not visible, sir.
Is it visible now?
No, sir. Yeah.
Yeah.
So, a warm good evening to one and all present here. This is Dr. Naveen. So, I'm going to present a paper regarding auricular chromotherapy in the treatment of psychological trauma, phobias, and panic disorder. So, next slide, sir. So, this was published in the journal called as Medical Acupuncture Volume 30, third edition on 2018 June 1. So this was published by Brazilian scientist uh, Mr. Alexandria Masso and Fabiola Andrade and other of their teams. So to begin with, first you have to know about the outline of the abstract. Here they have used about 160 patients. In that, 135 people have experienced serious traumas, and 15 patients they have experienced specific phobias, and 10 patients they have experienced panic disorders. So they were 134 women, 26 men, and ages 20 to 60. So in that you have to take a point that 134 people were women which I'll be explaining the significance of that point a little later. So the result, it is like 93% of the population have shown positive response. The conclusion is that, yeah, we will see the conclusion a little bit later in a more explained way. So literally the conclusions was that they are drawing a pathway from the external ear to your brain. So that was the conclusion. And next slide, sir. Yeah. So here they have taken a criteria called as PTSD, which is none other than the post-traumatic stress disorder. Here they have hypothesized that the amygdala part is becoming large, and if the amygdala part is becoming large, the fear induced by trauma will be hypersensitized, and it will be showing exaggerated response. And you can see the hippocampus, which I've highlighted so small, right? So the hippocampus is becoming short, where the long-term memory and the short-term memory, the conversion is getting affected there. And also the areas of the hypothalamus, like the rostral arterial cingulate cortex and the dorsal arterial cingulate cortex, has become hyperactive. And so next slide, sir. And one more thing I just want to say is that the left side of the brain will be having decreased blood flow, which is the area of language and memory, and the right side of the brain will be having an increased blood flow, which is the area of sorrow and anger. So the criteria is like that. And the next one is like it has been analyzed by a treatment called as, by therapy called as eye movement desensitization and reprocessing therapy, which was given by Daniel Guillermo Aziz, which I've shown him in the picture. In that, the therapist will be moving the finger and the patient will be following that finger. Because of that alternative movement, the memories, the repressed memories are kindled, and the significance of this particular therapy is that 84 to 100% of the patients who are experienced PTSD, they have experienced 3 times 90-minute session, which was given by Shapiro on 2009. It was very successful study where the 84 to 100% of the people have experienced benefit from that, which means the PTSD memories have been vanished from their brain. So next one, sir. Now, so the paper is all about auricular chromotherapy, right? And auricular chromotherapy means they are combining auriculoacupuncture along with chromotherapy. So as we all know, chromotherapy has a mechanism called as photobiomodulation. In that, when a cell is exposed to light, it is prepared to generate energy. So here in this study we are using the yellow color, which is the color of metabolism as well as the color of stimulation. Next slide, sir. Now, in auricular chromotherapy, the main areas which included are the psychic areas in the earlobe. The area which is marked 1, it is the amygdala, followed by hypothalamus, and third one is the area of psychic scar, and fourth one will be the conflict line. So these 4 areas are stimulated. The next slide, sir. Now, the criteria which I've told here is the criteria of criteria of criteria of Zagio. So this is the criteria of Dr. Zagiro Kochi, which is a Japanese name. Actually, I have a little bit problem with that name. So this is the criteria which is given by Dr. Zagiro Kochi. Both the lobes of the patient, the patient will be palpated, and the most painful areas will be obtained, and the patient will be awakened. I mean, the kindled repressed memories of the patient will be kindled, and then the patient will be analyzing the memory, whether it is, they have to answer like whether it is a sorrow one, or whether it is giving sadness, like that. And after that, they will highlight the area of the point where they are pressing with the yellow color highlighter, and then again the stimulation is given. This is the procedure. What's the next one, sir? Now we will see the exact methods and materials which is applied in that study. So each session will be having a 15-minute duration, and they are using a probe, electrical probe, to identify the points, which means the sensitive ear points, and they are highlighted with a yellow color pen. Each patient will be sitting in front of a camera, and they will be answering the question of the doctor. And the EMDR is given, followed by the Zagro-Gucci's protocol, and which is combined with auriculotherapy. So that is the thing. So talking about the subjects, they have belonged to like upper middle class kind of people, and they can able to analyze the things even more better, like whether the memory is giving sorrow, or whether the memory is giving sadness. Like when the therapy is given, the image of that particular event will come before the patient, and the patient is told to analyze what kind of event is that, and they are re-experiencing that particular event. And so next slide, sir. Yeah, so this is the procedure. The Aziz protocol and the Zagrogochi's protocol were applied, and then on stimulating the points repeatedly with the help of the yellow color highlighter pen, the patient is found that the images of that particular the these things where the particular incidents have been disappearing, and that is yeah, the mechanism I'll tell you. So the next slide, sir. So now we will see the results. The 93% of the patients were benefited among this, and here in that 11 patients, so it is like one people will be being in prison, one will be suffering from abortion, so like that different set of incidents they will be suffering, and that will trigger the PTSD over there. So by giving our protocol, 93% of the people were reported normal, and they have shown positive responses also. Next slide, sir. Yeah, so we will discuss the mechanisms here. Fine. So we are entering into the individual subconscious mind, and we will be concentrating the individual's traumatic situation in a different way. And here you can observe the well-regulated coordinated stress response regulation, which were given by the pituitary hypothalamo adrenal axis. And so this axis, pituitary hypothalamo adrenal axis, is being well regulated here. And so on applying this particular protocol, it has been understood that the high exaggerated response of the amygdala has been come down, and the short-term memory and the long-term memory has been regulated in the hippocampus, so that the all stress-related, the trauma-related events have been going into the short-term memory, and finally it is getting vanished. And also the left side of the brain is receiving more kind of blood supply. And one thing you have to analyze, that the person who is left-handed will be having a positive, I mean the opposite thing will be there, like the right side of the brain will be showing decreased blood circulation, and the left side of the brain will be showing an increased blood circulation. Now the gender discrepancies here, the most of the participants were women, and they were very much keen and interested on the study, and they just want to get rid of that PTSD. So it is very much clear that the 10th principle of naturopathy, patient's own will to get will help them, right? So that is the 10th principle. Here the 10th principle is literally proven, and yeah, actually this mechanism is not in paper, but I just so in my opinion I'm telling that the 10th principle of the naturopathy and yoga has been come true here. And the next slide, sir. Yeah, so the conclusion is that uh, these people have invented a pathway from earlobe to the brain, so which will be very clear to you, right? So like we are first starting on the earlobe, and then in the earlobe we are stimulating the amygdala, and then the area of psychic scars, and hypothalamus area, hippocampus area, everything, and we are drawing a pathway from the external ear to the brain. So this is all about the study, and thank you so much for the journal club, and thank you so much for Venugopal sir to give me this wonderful opportunity. Thank you so much.
Thank you so much. So here the auricular chromotherapy part is using a yellow color marker and marking it on the earlobes. So that is what we are. I mean, they are calling it here as auricular chromotherapy. Is it?
Yes, sir. Yes, sir.
Okay, and they are combining that with another therapy, EMDR.
Yes,
Is it?
sir. EMDR.
Okay, fine. Did they have any control groups?
Uh, no, sir. It has. It. I think it is not mentioned that whether it is having any control group.
Okay, fine, good. But the thing is, it's really interesting.
Yes, sir.
See, someone has raised the question there.
Someone has raised a question.
Yeah, can we
Can
understand?
we understand? Sorry. Can we understand? Is it the benefit of Akku or color? Was there any control group with Akku or only color?
Yeah, that's what, like,
Yeah.
control group. It's an issue,
Control group. It is
and
an
my
issue.
problem is it's not even about auriculotherapy or the color. The problem here is whether it is the eye movement therapy or is it because of the auriculotherapy we're having the effect here. Because if they're going to combine
sir.
both, so we might not be getting, like, what to say, the desired result. But it is really interesting. Like, one thing we have learned today is there's a therapy called EMDR and is beneficial for PTSD and to overcome phobias. Good. And
Yes, sir. Yes, sir.
yeah, and the best part for a naturopath here is the effect of auriculotherapy. Auriculotherapy could be beneficial in psychological traumas that patients are undergoing. And yes, there's another way, not just with needling alone. Even with chromotherapy with yellow color, we can stimulate.
Yes.
Yes.
So here the chromotherapy has proved evidence-based. That is the one.
I mean, might be conclusion of the authors there, but it is until and unless you have a control group. One thing. Second thing, can you please explain the mechanism once again?
Mechanism on side.
Do you want me to share a slide, or do you want to say it by
No, sir.
yourself?
No, sir. No, sir. No,
Yes,
sir.
please. Yeah.
So first I will say the hypothesis in the PTSD. So what is happening in that particular disease? Here you have to understood that the amygdala is being hypersensitized and it is showing exaggerated response because of the increase in size. And second thing is the hippocampus is reducing in size so that the conversion between the short-term memory and the long-term memory is widely affected. And the third thing is the blood flow. The left side of the brain will receive the decreased blood flow, which is the area of language and memory, and in the right side of the brain there will be an increased blood flow where the sorrow and anger areas are situated. Here this is exactly opposite in case of left-hander. In left-hander the right side will be the blood flow will be increased, and in the left side the blood flow is decreased. And this is the exact mechanism of PTSD, and the exact mechanism of the therapy here is that the reversing of that particular mechanism. It is nothing but the amygdala is being controlled. It is not so much exaggerated after the therapy, and the hippocampus, which is the conversion of the short term to the long term memory, is being regulated, and also the blood flow is also normal. And one thing is that the coordinated and regulated response of the hypothalamo pituitary adrenal axis. So this is all about the mechanism of this particular study. Hope you understood. Any brain imaging? The brain imaging which has been used here is the fMRI. Functional MRI studies have been used here to analyze the the amygdala is being exaggerated and the hippocampus is working less, like that. Sample size 160 patients, I guess.
Yeah, the sample size is quite good. It would have been better if there was a control group
Yes, sir. Yes, sir.
instead of just putting all 160 into like pre-post design. So if there's a control group, that would have been better. That's one thing, and there's like too many interventions in. So we
Yes, sir.
cannot
More
like
interventions are combined.
yes. So just like with most of our yoga and naturopathy therapies, The moment we are trying to publish it, the problem comes like how to overcome this confounding factor.
Yes, sir. Since yellow color is dominant and in EMDR, as when we are telling the patient recall trauma is there, no, there won't be a chance of triggering here, because in PTSD, in EMDR they are using the alternative movement therapy. So it has been proved that 90-minute session of EMDR is trying to reduce the repressed memories and the image which is appearing in front of the patients. So there won't be any chance of triggering there. Possibly it could vanish. The image will be vanishing as the day passes. One last, can you please tell the limitations given by authors?
Good, very good question.
Limitations, I think they have not given any limitations, sir.
Okay.
Maybe I haven't observed, or I don't know, but still I didn't observe any limitations here.
Okay. Yeah,
But
I
the
mean,
one critical
yes.
but the one critical point I can mention is that the combination of 4 therapies, where you'll be unable to identify whether which therapy is being much effective here.
Interesting.
Challenges faced.
Have they mentioned anything about the challenges faced while taking
No, sir.
sample size?
That
Because
is also
160 is
not
huge.
mentioned.
160
Yeah,
is huge
160.
sample size, and people with PTSD and phobia, if they could get 160 people in, what would be the possible challenges?
Maybe.
No. What did the authors mention? Let us not
That
just.
also they have, no, sir. No challenges mentioned
Yeah.
there.
Okay. Fine. I mean, let us not just what to say. Try to imagine what they underwent.
Yeah,
We're just trying to.
that's what, sir.
Yeah.
In that study, they have not mentioned any challenges or any kind of limitations and all. Sir, the authors of the book told only senior citizens.
Oh, yeah, roll the.
The authors of the book told only senior citizens. Why are older people not observed?
What book?
Um, the age group, I think they have asked. Maybe because, when you are concentrating on the senior citizens, they might not be able to continue the studies, or maybe they will be having some other complications and other comorbidities, which will prevent, which may give a bias to the study.
Okay. Let me just tell about one more research methodology term here. Last
Yes,
week
sir.
we saw a term called block randomization. The randomization we put
Yes, sir.
one sec. For block randomization we have instead of normal randomization, whether going into the intervention group or control group, block randomization is putting the peoples in block. Like if there are 10 people, 5 of them would go into group A and 5 of them go into group B. So that's called as block randomization. Now today I just want to introduce another term. It is a sampling method. Okay, one sampling method is called convenience sampling. Convenience sampling means if I'm having a clinic, like a psychology or a psychiatric clinic, I take in patients whomever are coming and meeting me in my clinic. I don't go outside and recruit patients based on the criteria like this age group, this much duration of psychological disease, or this particular psychological or psychiatric conditions. I don't have a set of what to say characteristics and go out and try to search them and find them and bring them in. Convenience sampling is there will not be any randomization or anything of that sort. Whomever patients are walking into my clinic, I take them up and do research. Of course, there will be inclusion and exclusion criteria, but on the whole, if I am going to recruit all the patients who are coming into my clinic, I will not be taking more of this age group. I want to take this particular sample and other things. So that's called as convenience sampling. So for randomization, if I'm going to compare a conventional group, that would be answering the other question as well. Why did they not have a control group? Like in our hospital, if a patient is stepping in, my job is to treat them. I'm not going to say like if 4 patients are coming, yeah, 2 patients come and 2 patients will be in the waitlist control group. We cannot do that. We have to what to say, treat all 4 patients. So that comes under like kind of convenient sampling. Okay, that could be one reason why they did not have any control groups, because it was not like research kind of thing they had tried to do. And what is the duration of the study? Dr. Naveen? Okay.
So duration. So duration also they have not mentioned, sir.
Is this a PubMed index paper?
Yes, sir.
Okay.
PubMed Central.
Okay, PubMed Center. Fine.
Sir, excuse me. Sir, Vibhas sir has asked a question. Could you please able to answer him, sir?
You chose the paper. You only should be answering that.
Sir,
So-
actually, I'm unable to get the question.
Okay.
Quality of
Yeah,
journalism is the content.
Sir, Bas sir, if it is a PubMed index paper, I think we take it for granted it is a quality journal as such. But here the problem is, of course, even if it is a published one and published in PubMed also, there would be a few limitations that would be there would be in the methodology and other things. Even though this has got like methodological flaws, it still got published because of the 160 sample size. I want to present like our own paper which just measured fasting blood glucose levels for a 10-day yoga intervention. So it might sound like anyone can reduce the blood glucose level in 10 days, and FBS is not a robust marker. But the thing is, our sample size was 700 to 800 plus. So because of the sample size, even if it is a pre-post design, it gives some quality quality outcome. It has got something for the research community, it has got something for the clinicians to perform in their everyday practice. I think it's because of the sample size the article would have gone through. Apart from that, I think like the journal is a good journal. Yes, sir. Hope that answered your question, sir.
Sorry, sir, I didn't get your question. That's why I approached Venugopal sir. Please forgive me.
Yes, sir. Thank you, sir. Okay, great. So there's so many questions about this paper because everyone was concerned about the methodology part, which is really good. It's really good because we are starting to learn, we are starting to see and understand that research doesn't mean like if they have done a pre and post and they have published it, that doesn't make the paper or the study design good, right? So there is always a chance for improvement. It doesn't matter like how good a paper is, and many of them had actively participated in this little discussion. Awesome. Thank you so much, sir. Chosen by them are according to DSM-5 or ICD-11 criteria. Okay.
No, I think they have randomly selected the subjects.
No.
There
Purnima,
are two criteria.
yeah, Purnima, I think like he has to go through the paper again. I'm sure like no, DSM-5 and ICD-11 criteria are two different things. She's asking like how do you diagnose it as PTSD or phobia? So the methodology part, like I think I'll update it in the group later. You can just go through take up all these questions, whatever that's been put forth, and try to answer it in the Research Alchemist group.
Okay.
Okay, fine. And also please do share your full text articles as well, both Dr. Naveen and Dr. Nanjesh Gowda.
Sir, yes, sir.
Yeah, please kindly share your full text article in the group as well, so that others would be able to go through them. And from next
Yes,
week, what we can do is, even before the presentation, kindly share your papers in the group, and if anyone wants to present for this journal club in the future weeks, kindly do ping me so that we can add on. And from next week, I think I will be doing one presentation, and one of your presentation, two of us can present it together. And also, like, I should give you the option of choosing what has to be presented. If you are going to look at hydrotherapy or diet part or yoga part or the chromotherapy part, we'll just have a poll in the group and then we can select for that. And two more questions. Yeah, full text article is coming up. Okay, all right, fine. What are the psychological changes in both? Right, you told about the fMRI changes. So psychological changes, have they mentioned anything, Dr. Naveen?
Yes, sir. The repressed memories that have been coming down,
Yeah.
and the image which is being appearing, like the traumatized event, the image of the traumatized event, the image is appearing, and then it is gradually reducing. So the person will be able to feel relaxed, and again the recurring of the events, recurring of the PTSD is being reduced.
All right. Okay, fine.
So
Yeah, I think it's worth trying through the auriculotherapy or auricular chromotherapy part for any psychological related traumas. Okay, thank you so much, and thank you everyone for the active participation. I think we are moving beyond 9 o'clock now. We'll just wind up for today. Thank you so much. Good
thank
night
you, sir.
all.
Thank you.
Thank you.
Thank you, sir.